Today, we're diving into something that affects millions of families, substance use trends that parents need to be aware of in 2025. The landscape of substance use is always changing, and what was true when we were growing up might not apply today. New products, changing laws, and social media have transformed how young people view and access substances. So let's bridge that gap together. Vaping is not new, but it's evolving. Today's e-cigarettes are more discreet than ever, often resembling USB drives, pens, or even watches. The biggest concerns? Flavors that mask the harshness of nicotine, and nicotine concentrations have skyrocketed. One pod can contain as much nicotine as an entire pack of cigarettes. Signs of vape use can include increased thirst, sweet smells, unfamiliar tech devices, small cartridges, or pods. You can start a conversation with your child by asking, "Vaping devices keep changing. What are you seeing at school these days?" Nicotine pouches are one of the fastest growing nicotine products among young people. These small tobacco-free pouches are placed between the lip and gum and contain a powder made of nicotine, which is delivered directly into the bloodstream. Their accessibility, discretion, and marketing is concerning with flavors like mint, fruit, and coffee. And because they're tobacco-free, they face fewer regulations than traditional tobacco products. Nicotine pouches come in small white pouches, are the size of Mentos or chiclet gum. They are packaged in circular containers. Also, be aware of white stains on clothing and frequent spitting. If you see people using nicotine pouches or brands like Zyn on social media or TV shows, you could ask your child, "What have you heard about these nicotine pouches?" Today's cannabis is not what it was decades ago. With more states legalizing adult use of marijuana, perceptions of risk have plummeted. But today's cannabis is not what it was decades ago. Modern strains can have THC levels more than 3 to 4 times higher than in the 1990s, and consumption methods have diversified beyond smoking with options like edibles, vapes, and concentrates. Marijuana use during adolescence has been linked to negative impacts on brain development and mental health problems like depression, anxiety, or at times psychosis. At the age that young adults are learning and becoming new drivers, remember that driving under the influence of marijuana can be extremely dangerous, as it can impact your reaction time, perception, and coordination. You can talk safety with your child by offering options should they be in a situation where the driver is impaired. For example, you can come up with an emoji symbol that they can text you to let you know they need to be picked up, no questions asked. Even today, alcohol is still the most commonly used substance among teens. While overall use has actually declined in recent years, the way teens are consuming alcohol has changed dramatically. Today's alcohol landscape is dominated by sweet-flavored options that mask the taste of alcohol, like hard seltzers, alco pops and coolers, and spirit-based ready-to-drink cocktails. Many teens don't even consider these real alcohol. And social media-driven drinking games and challenges have made dangerous consumption patterns like binging more normalized. If applicable, you can use yourself as a way to open dialogue. Think back to when you first tried alcohol or share a situation you experienced with alcohol, and ask what types of alcohol are kids your age talking about. Prescription medications, particularly ADHD stimulants like Adderall, continue to be misused, often for studying or weight loss. Academic pressure can be intense, and some teens see these medications as performance enhancers rather than drugs of misuse. Teens often use these types of medications as study drugs. Many think that they're safe because doctors prescribe them, but no one should take medication unless it is prescribed to them. At home, you can ensure medications are secure or locked and have conversations with your child by giving them space to ask questions. Fentanyl, a synthetic opioid 50 times stronger than heroin, is being found in counterfeit pills and mixed with other drugs. What's concerning is that many teens don't intend to take fentanyl. They think they're getting something else, but counterfeit pills often look nearly identical to prescription medications, and even one counterfeit pill can be fatal. One way to support your child is by practicing or role-playing with them on how to manage peer pressure and how to decline a potential offer of an unidentified pill. Social media has transformed how substances are marketed and normalized. Algorithms can push content glorifying substance use, and teens are often exposed to misinformation. Social media trends that go viral, like the Benadryl challenge, can lead to excessive use or glorify states of influences. The high view counts can push influencers to promote these trends or specific brands of substances. It may help to have conversations about what content caught their attention on social media this week and/or what trends are popular at their school. What can you actually do with this information? Build trust through ongoing conversations by finding opportunities to talk about substance misuse and risk, not just one big drug talk. Focus on health and safety, not just rules. Always stay curious, not judgmental. Educate yourself on warning signs of substance use and mental health symptoms. You can also role-play scenarios involving peer pressure scenarios, saying no or planning an exit plan. Identify trusted adults that your child can go to if you're not available. The reality is that young people are going to encounter substances. Your goal isn't to create fear around substance use, but to build trust and communication with honest dialogue and good information. You're giving them the tools to make better decisions.